I'm Dr. Michael Miyazaki, and thank you for joining us. Today we have Dr. Yasmeen Peterson, and we've seen her before in some of these programs. She does a lot of documentation and work with some of the new products. And so today we're really excited because she's going to be talking about a new product called Remin Gel that she's been using all through the beta tests. So it must be almost like a year now. And so today she's going to share some of her experiences using Remin Gel. All right, Dr. Peterson, I'll turn it over to you.
All right. Hello. Thanks for having me. I'm Dr. Yazzie. I'm a general dentist and I practice in Sacramento, California. And I've been using Remineralization gel since I think August of 2025. So my patients have been using it for quite some time now. And I've been able to beta test on probably like almost 20 patients. So I've been able to see how effective it is. And I want to share my experience with you today. So before we jump in, I just want to say that my hope for today is that you'll be able to understand how Riemann gel works, how it fits into the PerioProtect ecosystem. You'll learn about PerioProtect gel and PerioProtect trays. We'll give you some scripts on how to talk to patients and a workflow to make it easy to implement into your practice. All right, so before I show cases or protocols, I wanted to make sure that we're using the same language. So I wanted to go over some key terms. Number one being generalized sensitivity. So generalized sensitivity is characterized by short, sharp, and acute pain that arises from exposed dentin. And it's in response to stimuli like hot, cold, sweet, or even touch sometimes. So, second, I wanted to go over white spot lesions. And white spot lesions is more of a descriptive term. It's the first clinical sign of an enamel demineralization. It's going to appear as opaque, chalky white, non cavitated discolorations on the surface of the tooth. Third, I wanted to talk about incipient lesions, and that's mostly E1 or E2 lesions that we see typically on a radiograph at the contact point between two teeth. And they are non-cavitated, and I wanted to make sure that, we talked about how this is the point where they can still reverse because they're non-cavitated. And then number four being cavitated lesions. Obviously, this means that the enamel has broken down, and now we are looking at the dentin, and there's been a visible hole or cavity created inside the tooth. Okay, moving on. All right, so how often do we see this in our practices? White spot lesions. So, uh, white spot lesions obviously is like I said earlier, is the first sign of enamel demineralization. Um, the good thing about a white spot lesion is that we can show it to our patients and we can let them know that this is an early sign of disease. And today I want to talk about how we want to practice being more proactive, and this is exactly the type of patient that we want to have a standardized protocol for, because a lot of the times we'll either monitor, or tell them to change their toothpaste, things like that. But if we can create something standardized, I think that that would be really beneficial. So let's go ahead and move on and look at a radiographic version of something like this. So how many times have we seen this on x-rays? This x-ray is used in conjunction with Pearl AI, which is an AI overlay. And as you can see, in between all of these contact points on the teeth, there are incipient lesions forming here. And so whether you decide to fill these or watch them, it's nice to have a protocol that a patient can easily follow at home. And so that's what we'll talk about today. And then hygienist, how many times have you heard these questions all day? Can we just hand scale? My teeth are so sensitive. Can you rinse my mouth out with warm water or hot water? Is there something other than cold water that I can use to rinse out all of this? stuff with. So patients' teeth are super, super sensitive sometimes. And before you're even getting in there and cleaning, they're already bracing for pain. And, they can't tolerate the water, they can't tolerate the air, they can't even tolerate polishing sometimes. And at the end of the appointment, it was exhausting for them. It's harder on you. But what if there was a better way? And today I want to talk about how we can go ahead and give you that better way of reducing sensitivity, supporting remineralization, and addressing white spot lesions and early lesions. So let's go ahead and move on to reactive dentistry. So more, I would say, traditional dentistry is we detect caries, we restore them. Sometimes we restore them with a larger restoration, and sometimes it can go to endo, and then kind of the worst possible case is an extraction, and now they're needing an implant or dentures or whatever it may be. So this is harder on the patient, can be harder sometimes on the dentist. The tooth has not as great of a long-term prognosis. But what if we could treat these, patients before they become a problem? Is there something that we can do to prolong this so that way they're not getting to extractions or larger restorations or even endo? What is something that they could do at home? So, moving on from a reactive dentistry model, I think nowadays, not even just dentistry, but even medical is moving to a more proactive protocol. Everybody wants to be able to find things out before they become a problem. That way, they can take care of it earlier. So, proactive dentistry means having systems and tools for early detection. That way, we can treat them early and we can monitor and stabilize our patients, leading to more predictable outcomes, better patient experience. They can trust you more and hopefully lead to even longer patient retention now that patients are coming in and out of our doors because of insurance or lack of insurance, whatever it may be. So I think that having something that they can, that shows them that you actually care and not there to just drill and fill. All right, so moving on. So today, like I said earlier, today I hope you'll leave with understanding who Riemann Gel is for, the PerioProtect protocol, how Riemann Gel works. We're going to provide a workflow that you can incorporate into your office and some scripts, and then a simple revenue model of how this can be really profitable. All right, so PerioProtect is an ecosystem. So Vista Apex has created PerioProtect, and under PerioProtect we have Riemann Gel, PerioGel, and PerioProtect trays. So obviously today we're mostly going to be focusing on Riemann Gel. Riemann Gel is great because it remineralizes enamel. It was created for sensitivity, and it provides fast relief from sensitivity, and it can also reduce the appearance of white spot lesions. Periogel can sometimes be used in conjunction with a Riemann Gel protocol. So Periogel is a hydrogen peroxide gel. It breaks down the cell walls of bacteria, causing infections associated with gingivitis and periodontitis, and it can whiten teeth and freshen breath. And now we have PerioProtect trays, which is a custom fitted FDA cleared tray that helps to deliver these medications, and it's going to create a seal, and it will treat gingivitis, periodontitis, and the sensitivity and remineralizing enamel by delivering the medication directly onto the root surfaces and into the gum pockets. And from what I've been told, I believe that Periogel and Riemann Gel in conjunction with PerioProtect trays, because of the seal that PerioProtect trays create, it can even be pushed up to 9 millimeters into the sulcus. So I kind of went over it briefly already, but why are PerioProtect trays so effective? And I think these images are great visual as to how they work so well. So obviously, bacteria thrives deep below the gum line in the periodontal pocket, and we know that they thrive down there because anaerobic bacteria is usually the bad bacteria, and there's a lot less oxygen deep inside those pockets. So, And brushing and rinsing, flossing can't reach those areas because it's so far down there. But a perio protect tray, which provides that seal because it goes over the gum line, is going to help push that medication deep into the sulcus. If it's periogel, it's going to bring that hydrogen peroxide, delivering oxygen to help neutralize some of those anaerobic bacteria, creating less bacteria inside the mouth, fresher breath, whiter teeth. And if it's Riemann gel, it's going to help push that Riemann gel along the root surfaces, creating less sensitivity and removing those white spot lesions or remineralizing those white spot lesions. So, what's included in a kit when you receive your trays from PeriProtect? So, PeriProtect is going to come with all of these things right here. So, we have a nice gift bag, and then obviously your PeriProtect trays. There's a carrying case for the trays, and then a little travel bag that you can place your carrying case in. It'll come with 3 tubes of gel. On the lab slip, you'll write which tubes of gel you are looking to prescribe your patient, and then you'll also receive a home care guide where you can circle the specific instructions for your patient. All right, so the Riemann gel protocol. So I wanted to make this super simple because it is really simple. So what you're going to go ahead and do is you're going to place a ribbon of gel inside the Perio Protect trays. You're going to insert the trays inside the mouth. You're going to go ahead and spit out any excess gel, and you're going to wear that filled tray for 15 minutes, twice a day until the first tube is gone, and then maintaining with once a day. And if you're going ahead, if your patient has sensitivity, white spot lesions, high caries risk, but they also have maybe periodontitis or gingivitis, something going on around the gums, then you'll use periogel in the morning in the same manner, and then Riemann gel at night. And you never want to mix those 2 gels together because it'll lower the effectiveness of each gel. All right, so let's go ahead and go into a workflow. So this is kind of how we do it at our office. So I wanted to make it really simple. So the great thing about PeriProtect is it's mostly your team doing it for you. There's very little doctor time, making this really easy and easy to standardize. So number one, so Hygiene is going to go ahead and identify candidates. So we're looking for patients that have sensitivity, white spot lesions, incipient lesions like we saw in those x-rays. Is there recession? Are they high caries risk? And ideally, Hygiene would go ahead and either show the patient that using the radiographs, or if they're taking intraoral photos, showing them using the intraoral photos. Now your doctor can come in and they're going to go ahead and frame this to the patient as an early disease signal and talk about how the trays can help by the delivery, talking about that seal, the sustained contact time, because we're wearing those trays for 15 minutes. And so maybe this might take the doctor, I don't know, five minutes of their time just explaining, kind of affirming what the hygienist has already showed the patient. Hygiene can go ahead and present the plan. They know how they can even demonstrate trays, the gel kit. They can also set expectations. If it's not the hygienist doing it, it can also be the assistant. Same thing after that, scanning and impressions by the assistant. And then when it comes to delivery, about 3 weeks later, the assistant will go ahead and have the patient try in the trays. They'll go over home care instructions, the QR code, how to register their trays, making it really easy. And then usually a follow-up will happen. I usually have my patients come in for a 4-week checkup. This is very quick, probably only takes maybe 10 to 15 minutes. And I'm just there making sure that everything is fitting properly, that they're using the trays, probing if need, taking photos if need. I don't really take radiographs, but if you want to, maybe you can. But why this works so well, like I said earlier, is it takes very little time from the actual doctor, where the team can pretty much do this for you. And as long as everyone is saying the same thing, it becomes really standardized. The patient is going to go ahead and find it really easy to use at home. All right, so what to tell your patient? Number one, I think it's really important to co-diagnose in the form of a question. Never telling your patient that this is what they need, kind of letting them lead you to the answers. Asking them a question such as, could you help me figure out, why so many cavities are forming? And then leading in with concern, Bob, I'm concerned I'm seeing early mineral loss. These white spot lesions or these incipient areas that we see on the x-rays are the first sign of disease. And we want to talk about our goal. So our goal is to rebuild and stabilize this before this becomes a problem, something more expensive, such as a filling, crown, root canal extraction. You want to express empathy towards your patient. Let them know that I know you're trying hard. It's just that brushing and flossing can't always reach these areas where the problem starts. And providing a solution, we use custom trays that are super comfortable with specific medications for 15 minutes a day to help remineralize the teeth. The trays create a seal, pushing this deep along the gum line and in the space in between the teeth and gums to reach areas that your toothbrush and floss can't. So constantly reminding them that even though they could be doing everything at home, sometimes even the best brushers and flossers, there's areas that we miss. And so letting them know also what the result will be. We're aiming for sensitivity to improve, stronger enamel, and fewer fillings. And when a patient says, I need to think about it, we want to acknowledge them, say, I'm really glad you're going to think about it because it deserves your attention. What can you do differently starting today at home to improve your health? And of course, they're probably going to say brush and floss more. And affirming that, letting them know that that's a great place to start. Be sure to brush for at least 2 minutes twice a day, floss at least once a day, and that we're going to go ahead and document this. So we'll document what we decided upon, brushing and flossing more, and we're going to go ahead and reevaluate at your next visit. So what are the ideal patient candidates for Riemann gel? So patients that have chronic sensitivity, these patients, like I said earlier, these are the ones that can't drink ice cold water or cold water at all. If air touches their teeth, it hurts. They're high caries risk. So, like that patient that we saw, those x-rays, they're all really, really small cavities. But obviously there's something with maybe the pH of her saliva, or she's not brushing and flossing properly. So she's at a high caries risk now. White spot lesions, like we saw in that photo earlier, or signs of demineralization. So another way of saying white spot lesions. So what makes Riemann gel so unique? So Riemann gel is super unique because it has 3 salts. So it has calcium salts, phosphate salts, and potassium salts. And so basically this helps to, I'm losing my train of thought. Okay, so what makes a Riemann gel so unique? So Riemann gel is unique because it has calcium salts, phosphate salts, and potassium salts, and these help to neutralize the enamel and fill in microscopic gaps. And the other thing is that Riemann gel has a pH of about a neutral pH of 6 to 7. And so with that, there's 3 ways that Riemann gel can go ahead and remineralize the tooth. So it has hydroxyapatite precursors, and then it has free calcium and phosphate ions. So through pathway number 1, like I said, the gel itself has hydroxyapatite in it. There's nano hydroxyapatite, and then particles that are larger than the nano size. And hydroxyapatite is the mineral that forms most of the tooth surface. We already know that 95% of enamel is hydroxyapatite. So that hydroxyapatite is going to go ahead and bind to any damaged enamel and fill in those microscopic gaps. The second way that Riemann gel is going to go ahead and remineralize is through the precursors monatite and brushite. So these are similar, they're smaller than nanohydroxyapatite, and they promote faster nucleation, which just means that they're providing a scaffold on the tooth surface so that hydroxyapatite can build on top of them and close those gaps much faster. And then lastly, there are calcium and phosphate ions. And these ions are bioavailable, which means that they can produce precipitate out of the gel and bind to the tooth surface. So when there is an acid attack after eating, usually the phosphate and calcium ions will bind to that acid and then be removed from the tooth surface. And most people usually have, or most people that have healthy saliva, they have a lot of calcium and phosphate ions already in their saliva, and that can bond back to the demineralized tooth surface due to the charges that are going on the tooth surface. So to kind of summarize that whole thing, Riemann gel helps create conditions for minerals to be readily available and deposit wherever enamel has demineralized, meaning that there's those little pores or little gaps that need to be filled. And so this kind of goes back to the trays. So the trays become a big deal because, again, that seal and that sustained contact time increases the chance for more change for that patient. Alrighty, so if you look here, we can see that the yellow circle is the size of the dentin tubule, so that's the largest circle here, and then orange is about the diameter of the hydroxyapatite precursor compounds, which are monatite and brushite, and they're a lot smaller than the actual dentin tubule itself. And then if you look at the ions, that little blue dot there, you can see that they're even smaller. So this allows us to see that those particles that are smaller than the dentin tubule actually penetrate deep into the dentin tubule, making sure that that remineralization process is so thorough. And that's how it works so well. And so like we said earlier, Riemann gel works in a wide pH range. So at a lower pH range, those precursor compounds, monatite and brushite, are formed. But then on the other end of the spectrum, at a higher, more basic pH, hydroxyapatite is formed, making this gel super effective. And it also works really well in a neutral pH as well. Okay. And then going to this bench study done by Kongqi, who's the researcher at Vista Apex, we can see here that Riemann gel, there's the control, and then on the left, and then a tooth was demineralized for 7 days. So out of these pictures, what we want to pay attention to is the colors. So the green is like that flat surface, the blue and the purple are the demineralized areas on the surface. And if you look all the way to the left, after 11 treatments of Riemann gel, we have a lot more red, which is that higher surface, meaning that Riemann gel has all those minerals to build upon each other. So monatite and brushite, followed by hydroxyapatite and those calcium and phosphate ions. So this just shows how effective Riemann gel is. Okay, so going to clinically. So in my office, I have a lot of tools to go ahead and measure clinically in my patients. So I use Pearl AI, like I showed you earlier. So it's that AI overlay that helps me look at incipient lesions, all that stuff. It can even give me a percentage of how far that lesion has progressed through the enamel to the dentin. And then we have IOBio. IOBio is a series of cameras that have biofluorescence. And in their system, in their software, they also can provide like an AI analysis. So I can go ahead and show my patients how much of that enamel has remineralized after they've been using Remingel. So now that we can go ahead and talk about cases. So I have a lot of them, but today I'll talk about four. So I wanted to start with sensitivity. So this one, she was a 72-year-old female treated for generalized sensitivity. Her main concern was that she was unable to drink cold water. And so for her, she had a little bit of gingivitis. And so her protocol was to use Periogel daily in the morning for 15 minutes, Remingel daily at night for 15 minutes using PerioProtect trays. And after about roughly a month, we found that her symptoms resolved by 100%. And now she's able to drink cold water, and she's very, very happy. And you don't realize, like, this sounds silly that she's able to drink ice cold water now, but this is something that she had not been able to do for years. We have a testimonial for her on our Instagram at Miyazaki Dental. So if you're interested in seeing what she actually says and hearing it from her, you can go ahead and find that video on our Instagram. And so sensitivity, how Remingel was made for patients with sensitivity. So how does it do that so well? So I kind of talked about that already. So these are pictures of a tooth surface, and you can see the dentin tubules. So on the left, it's untreated, and you can see that those dentin tubules are open. And then if you look on the right, you can see that the dentin tubules are closed. So basically, how did that happen? So normally you have sodium and potassium inside those dentin tubules, but when you have too much sodium and not enough potassium, that can cause some sensitivity to the nerve. So Remingel, like we already know, has those potassium ions because it has all those three salts in it, which is calcium, phosphate, and potassium. And those ions are bioavailable, and they're suspended in the gel. And so after 7 applications for 15 minutes, we can see that those tubules are now occluded, and that's going to go ahead and neutralize that sodium, making the patient feel better and basically taking that pain away. Oh, right. And this kind of, reiterates and says the same thing. So potassium ions, they diffuse into the dentinal tubules because they're a lot smaller. They neutralize those sodium ions, and they can depolarize the nerve, or that can depolarize the nerve and cause sensitivity. So because Remingel, it combines desensitization with remineralizing agents, it's able to close those tubules and make your patients feel better. Okay, so another case study, these are incipient lesions. So I kind of want to show you, again, this is using Pearl AI. And I picked these 2 x-rays because I thought that the contact point was pretty similar on each one, because sometimes the percentages can change depending on the angle of the x-ray, but I thought that this one was pretty close. So this patient was using Remingel daily for 15 minutes with PerioProtect trays. And in July of 2025, you can see that that lesion is 75% to the DEJ through the enamel. And if you look on the right, in October, almost 4 months later, that lesion has gotten smaller, and that is 70%. Now it's 70% to the DEJ through the enamel. And we have white spot lesions. So this is a 73-year-old male with white spot lesions. There was no prep, so no etching here. We just did a cleaning. And his protocol was to use Remingel daily for 15 minutes with PerioProtect trays. And so what's really great about this one is in these photos, you can see how chalky and white those demineralized areas are along the gum line on day 0. And then after 3 months, they significantly get darker. So definitely, this is a great case because I think it really shows why the Perio Protect tray specifically works so well, because it's holding that gel right up against that gum line area and then pushing that gel, a little bit below that gum line, making sure that we can really get into those hard places. Okay, so this is a caries case. So like I said, this probably isn't the most ideal candidate for Riemann gel, and she knows that, but she is a 41-year-old female and she has dental anxiety and she has cavitated lesions kind of all over. And so, due to her dental anxiety and the amount of cavities that there are, she really takes her time in choosing when she wants to fill these lesions. So, to help prolong the process and hopefully slow it down, we decided to use Riemann gel daily for 15 minutes with the Protect trays. For the first 3 months, she was using it once a day. And then on her own, she decided to use it twice a day because she loves it so much. So these photos are using the IO camera, and it's biofluorescent. So that lower picture on the bottom, basically what you're seeing, or on both photos, but the bottom is from September 2025 and the top photo is from February of 2026. What you're seeing is that red is the bacteria that's being highlighted. So basically the porphyrin rings and the bacteria are highlighted in red. And so these types of photos are really great for patient education, showing them that, red is bad and letting them see either where plaque that's more than 3 days old is hanging out, or cavities and things like that. So I think it's really useful. And then, but yeah, so you can sort of see that it looks like they've been started to become a little bit more faint in about, I think, what is that, 5 months? And so just on her own, her comments have been her teeth feel stronger and she can't see her tongue behind her teeth anymore. I think what she means is like her teeth aren't so translucent as they used to be. So that's pretty interesting. But what you're seeing on the right-hand side here is called the MCA analysis. And this is through the software of those IO cameras. And so basically what it tells us is, or what it measures is the quality of the enamel. So the more green there is, that means that that's remineralized enamel or mineralized enamel. And then the red and the yellow means that that quality of the enamel is a lot less, so more demineralized areas. And so if you look at those numbers on the top, you can see from October of 2025 to February of 2026, it's been a 0.8% increase in the green. So in higher quality enamel, more remineralization. So, and then red has gone down and the yellow have gone down by 0.4 and 0.5%. So meaning that, yes, like the red is becoming less. So now there is more high quality tooth structure. And this is just the same thing, but just like a bigger picture. All right, so everyone wants to know, how much money does this make? So what we already know is that hygiene production often approaches break even after wages. So these are just averages that I just got from Google. So the average hygienist hourly wage in the US is somewhere from $50 to $55 per hour. If they're working for 8 hours, that's somewhere from $400 to $440 per day that they're getting paid. And so after insurance reimbursement, for a pro fee, which is somewhere from, we're going to use $60. 8 to 10 pro fees per day. Total insurance reimbursed hygiene revenue per day is $480 to $600 per day. So not very much, but when we're using or providing PeriProtect trays and gel to our patients, we can make our offices more profitable, or our hygiene schedules more profitable. So PeriProtect and the gels add self-pay preventative care without relying on insurance. So if we look to the right over here, if we could provide patients, 3 patients per day with Perio Protect, that could be about 1950 per day. So because the free range, the number that I used here was 850. That's how much I charge for it in my office. And so per month, if there was 20 days, that would be an extra $39,000 per month. And per year, that could be an extra $468,000 per year. So high margin, like I said, very low doctor time and high patient value. Patients love this. It's super easy for them to use. It increases patient trust. You're trying to show them other ways that they can go ahead and be more preventative or slow things down, or, even if you are drilling and filling because they really need it, then they still could use these things to help slow down the progression of the disease or the high caries risk that they have. But yeah, that was pretty much it. So it's really simple to go ahead and prescribe this. There's a starter kit and there's a QR code here. That way you can go ahead and get more information. And just to recap everything. So number one, enamel dentin changes show up as white spot lesions, incipient lesions, or chronic sensitivity. Dentistry is shifting from reactive to more proactive protocols. Remingel is a neutral gel which has a lot of minerals in it. It works by desensitizing and including the dentin tubules and remineralizing those demineralized areas. And again, trays matter because of the sustained contact time, and it provides a much better delivery because of that seal as well. And like I said, this works so well in our office because it's low dentist time, so it's really easy to implement. Patients love it, high patient value, and it's standardized. It's really easy to use, easy for your patients, easy for you to implement into your office. It's kind of a no-brainer. All right. Well, thank you for listening, and I hope that that was helpful on Riemann gel.
Well, no, it's really good. I think yeah, today we are going through, as you mentioned, the change in dentistry where we've been very reactive and we always wait until there's something that we have to fix, which just means more money or cost for the patients, and it might mean they're a little bit more uncomfortable because we have to be drilling, versus now we do have some different delivery mechanisms and different things we can put on the teeth that actually help the teeth maybe kind of heal themselves so conditions don't get worse. And I think that's kind of our proactive care model that we're really trying to push in dentistry. And it's going to be better for our patients. And as you showed with your financial modeling, that it can be good for the practice too. So it really is win-win. And no, it's a great presentation. I really appreciate your time. And we look forward to hearing another presentation soon. Yeah, thank you.
Thank you.